Oh, ready? Okay. Welcome to our lower back pain and sciatica workshop. We're recording. Nobody can see anything, but we are recording it because it's the first time that I do it a little bit different. So if you do volunteer or come up and that's an issue, you can just speak up and just maybe not for later, just let me know. Because there's a time when I might come pull someone up and say, hey, can you show us? And just so you know, that's going to be the case. Once again, lower back pain and sciatica workshop. So either you guys have lower back pain, or you're here supporting someone that has lower back pain, or you're just here to learn for a friend that has lower back pain and you just want to pick up some information from them, which is totally fine. But it's not you in denial at all, so just for a friend. Before I get started, everybody has pens, little support things if they needed to, or reading glasses. I heard someone needed. Those days are coming for me. I picked up my little one. Anyways, okay, so being a lower back pain and sciatica, so I wanted to start by having you share, if you want, a little bit about what your lower back pain is like. So for example, I'll start with myself. Those days, I had back pain issues. And there was a time when I had a really, really bad injury. And so I couldn't sit, I couldn't stand, medications during the day and the night, Flexerol at night, Celebrex during the day. It was awful. So I went through a whole experience and I had trouble sitting, standing, moving, sleeping. It was not fun. Clearly, here I am without gotten over it. So that's a little bit about what you guys, if you want to share, could share. Anybody want to start a little bit? Tell me your name.
Angela Wagner.
Angela, hi.
Hi.
Okay.
Well, really, the first time I ever had sciatic pain was when I was pregnant with my second son.
Mm-hmm.
And then I thought later, it was like, okay, that passed. But years ago, I started getting it really bad. It's always in my left side. And it starts in my hip and shoots right down the leg.
How far down does it go?
To the calf.
The calf.
Yeah,
Okay.
it hasn't gone to the foot.
Okay.
One day it was really bad that when I got out of bed, my bed's a little higher.
Okay.
When I got out of bed, I couldn't even step.
So does it hurt more to walk or stand?
No, I mean, that was the only time. I went to a chiropractor, it helped.
Okay.
I haven't had it that bad, but still, like last night, it's not painful, it's just uncomfortable.
Okay.
It's just
And
I couldn't sleep.
what are the most uncomfortable positions for you?
Sitting too long,
Okay.
sleeping.
Okay. Standing and walking are okay.
Yeah, if I walk around, it's better.
Great. Thank you. Anyone else that wants to share some of their issues? Mary, right?
Last September, I herniated 3 discs.
Uh-huh.
And the sciatica pain started at the same time, and I thought it was part of the
Uh-huh.
herniated disc.
Uh-huh.
So I went through steroids, epidurals, physical therapy, and then finally had back surgery in January. And the back was fine, and I still
This
had-
year?
Yeah,
Okay.
January of 18. Back was good, still have
A little issue that you make you
not
sit.
little, worse than
Over?
ever. So that's been going on.
And what makes it worse right now?
Gosh,
Like
just sitting there like this.
Okay. Any other standing, walking?
Everything.
Does it go up or down?
It does sometimes, yes.
Okay. I'm sorry, we should do everything.
Everything. There is absolutely
And
not
how far
one
down?
minute of the day
Mm.
that I've been pain with, not 1 minute.
How far, where does it go?
It has gone into my foot.
Mm-hmm.
Yesterday I got a massage, so it's pretty well controlled now. It's only down to my knee.
Okay.
But never
All right.
goes away.
All right. That's enough.
And I've been told that it'll take 1 year to 2 years for a nurse to recover from surgery.
That's a long time to be dealing with this kind of stuff.
But
All right. Anybody? Yeah. Anybody else that would like to share what their issues are? Yeah. Tell me your name again. Fred. All right.
I was a farmer most of my life, so from the work and stuff. I just had an MRI done because I would get back pain so bad. I would, at one time I had to go to the hospital to get,
They gave him morphine.
yeah, morphine. But it's my back. But anyway, the MRI showed I have, what is it, stenosis?
Spinal stenosis.
Yeah. And my
Sciatica.
bulging
Bulging
disc.
No, you have degenerative disc.
Oh, whatever it is. It's, oh, I'm old, so I guess it wear out.
And what makes it worse for you, Fred?
So if I look like I dug some water backed up about 3 weeks ago, and I took a shovel and dug a little ditch.
So that
Yeah,
forward.
that kind of stuff, and like that.
Okay. And it's pretty central to your low back,
No,
or does
it's
it go down?
usually, sometimes it goes down a ways.
Okay.
My left side, but I've already had it on my right side. They're
And
probably,
how far down does it go?
probably to the knee.
Okay.
If it goes to the ankle, the doctor said he's gonna operate.
Oh my goodness.
But he wants him to go to the ankle. Yeah, that's very fun.
Okay. All right. Have you tried other?
I go to therapy.
Okay, that's right. You were saying that they
And it does help.
tenderize do meat
The meat
tenderizer.
tenderizer. they put on.
All right. All right. Anybody with something that would like to, a little bit different? And so this is your time that if you have some specific questions, this is how I know how to answer some more specific.
I have different.
Tell me. Tell me your name.
It started, Vivian.
Vivian. Okay.
Started about 6 months ago. From the groin, the hip. I went to therapy. They say it's from the back. But I've been going for 2 weeks and it hasn't helped. So today I went back to the doctor and I went for an x-ray and we will see where it's
Okay. And so it's kind of here and the hip.
Yeah, on the right
And what
side.
makes it worse? Sitting, standing, walking?
Lifting the right leg kills you.
So, but it's on your hip on the right, and so like the
Yeah,
driving
like
movement?
this. Terrible.
Getting in and out of the car, getting in the car. You gotta trade her in, is what that.
Oh, she needs a new car.
Trade her in, at the car.
All right. Anyone else with some questions that we can, because that's kind of like I said, if you wanted to share. If not, that's okay. Okay, tell me your name. Delphine?
So
With
I
an
have
F or a PH?
PH. I have 3 herniated discs, one touching the sciatica nerve. I had the illness of Perthes when I was a child, so shorter leg and stiffness in the leg. Stiffness, I'm not flexible. And I have nodules in the buttocks. And so I've done physical therapy, core strengthening and so on. And I've had tremendous pain in the buttocks on those nodules. That was the most handicapping thing.
Both sides?
No, right side.
Okay.
It can be handicapping to the point that I can't move. If I'm standing, I'm done. I can't
So
move.
standing hurts, walking hurts?
In a crisis, yes. Sitting will relieve me, but if I sit too long, then it's not relieving. And what has really relieved me were shots in the steroid shots in the nodules.
Got
In the
it.
back, I didn't get anything.
Okay.
And these are called back mice. There's a new study, it's not completely developed on it, and it's surprising. And these back mice actually can provoke groin pain. They will create.
Do you have symptoms that go to the ground?
No, I don't.
Okay. You
But
don't?
I read the research paper, and they can create hidden pains, including sciatica pain.
Yeah,
But working on the sciatica
that did
doesn't-
nothing.
No, it doesn't
Yeah.
work because
Yeah.
the problem doesn't come
Because
from
that's
there.
not the problem, but you
It comes
got
from
it.
the nodules.
Yeah.
So
And so
check,
are
check
they,
your nodules because
Yeah.
if you don't get any relief from the sciatica, maybe it's another thing.
yeah, that's a good point. Get to. Good. Anyone else or moving on? Any back Rose been quiet? Okay.
Vergus.
Vergus, that's
Mine is slightly different. I came in here with the neck issue
Yeah.
problem, pain radiating down one side. But
Uh-huh.
that's kind of like graduated to the back.
That's right, that's right.
So, it's now clicking a lot, and it gets really numb. Literally have to stop physical exertion,
Mhm.
like soccer or anything active. Sitting is worse. Standing is my preferred position.
Got it. All right. Good? All right, here we go. Moving along. Get rid of this. All right, so now that we have some idea, let's get started with some of the, this is not a test. You could have started it as a test, but this is kind of sort of the way that we're gonna go through as we learn what we're gonna do. Good? So what is sciatica? I've heard a lot of people talk about, oh, sciatica, and a lot of people think that sciatica is just something that goes down the leg. Well, the sciatic nerve, it's actually the largest nerve of the body, and it's actually two split nerves. It comes out, oh, this is not good. Yeah, where's this black? It kind of comes out like this, and do you see how thick that marker is? That's about how thick the sciatic nerve is. And so the little nerves come out of the spine, and then they join together to form the sciatic nerve, and then they go down the leg, and they split into all the different nerves that then go even down into your fingertip, in your toes, in your fingertips. Well, not your fingertips, I'm sorry. Down below. So it travels from your lower back, that's your next one, down the back of the leg, and then into the foot all the way down, as I was saying. So sometimes when you have pain that runs down the back of your leg, that could be something that's a problem in your back. True sciatica is the inflammation of that sciatic nerve. So if we can change your symptoms because it's standing and moving the back, that's not necessarily sciatica. So, sciatica sufferers can experience pain, as a lot of you have said, also numbness or tingling, and that could be anywhere from your back down to your toes. But something that's not in the sheet is you can have burning sensations and you can have even weakness. So the worst case is when someone presents with, oh my God, I can't put my toes up and I have that foot drop because of the nerve is irritated. So anyways, that's what sciatica is. Yes, Angela, yeah.
But I've been mentioned before, man. At age 15, I was diagnosed with a little bit of scoliosis.
Okay.
Very small,
Mhm.
or very minor.
Okay.
Could that be a problem? That could be part of,
It could
causing
certainly be,
Yeah.
depending on the curvature of the spine. It's kind of like with that little bit of a curvature, you may be at a little bit higher risk to develop certain things.
Yeah, because when I was diagnosed, when I went to a specialist in New York, doctor did tell me, he says, just don't have more than 2 kids,
Yeah.
because you're gonna have problems.
But that doesn't mean, so just because you guys see something on the films, that doesn't do like, oh my God, it had stenosis and degeneration. It's like, oh, did it tell you that you had some wrinkles and the white hairs are starting to come in, right? That could be right here, and if you,
I lost mine.
yes, I look a little younger than I really. So I want you to think about a kink in the hose, right? When you have a kink in the hose, it could be maybe you forgot to open the faucet all the way. Oh, that's why it doesn't come out, right? Maybe you have the hose and you know you opened it, but then you know how sometimes it just kind of folds on itself and it's like you just have to do one of these and oh, now the water can come out. Or maybe sometimes the nozzle can get a little dirt in it and it doesn't come out. So really it's trying to find out where that kink is in the hose to deal with that. And that's exactly some of the top 3 causes that we're gonna find out later. Okay, so who is this Jonna girl that stands up here in the front and like starts talking and everything? I mentioned that I had my own lower back pain thing back in my days of rowing. I'm lucky if I take my boat on the river these days, but It went out 3 times this year. Super excited. Still do it. One more. So it was a pretty significant back injury that kept me from doing many things for a good number of months. And finally, you know, I was running a temple at the time, and the physician was like, yeah, here, drugs. And I was working with the sports psychologist, and she's like, you know, do a lot of meditating and mindfulness. And I just took my car, my bike, and I just took off for 2 weeks. I just did a lot of hiking and backpacking, mental imagery, my own things, and that really helped me along. Then later on, I was an exercise physiology major in undergrad, and right after I finished, I did strength and condition. I was a strength and conditioning coach working with athletes for speed, agility, power, treadmills that went up to 26 miles an hour. Awesome, except I got bored. I was like, okay, all the athletes, here, do it. They do it, they get better, or they don't push themselves. They don't get as good unless they have talent. I got bored, and then I went back to grad school. Back to Temple, I did everything at Temple. Back to grad school for a few more years, and that's where, you know, I came to realize, wow, like, all these things that they could have done that nobody looked at. Like, oh, I could have used a good physical therapist at the time. But it made me who I am today, and the reason why I really decided that I wanted to specialize in sports and orthopedics. I had all this knowledge with sports. And now I want to apply it to people that are injured or have problems, because it's very similar. That's kind of why I think of, you know, I have the tagline, every patient is an athlete, because when you do an exercise routine, it's trying to get you to perform better. So, let's see. Oh, and then I ended up, after grad school, I ended up teaching at Drexel, so I've been teaching at Drexel for about 8 years now, and that's pretty fun. And kids came along, they slowed a lot of things down, but so once I started practicing physical therapy 11 years ago, I worked for a couple of different private practices where I would see 3 patients an hour, and so some of you that have had those past physical therapy experiences, I would be working on someone, all right, stand up a little taller, like, oh, go to the pool, go to the bike over there, and doing 5 things at the same time. Oh, you're done, your heat is done? Okay, hold on, and never really being able to focus. So I decided that I had this like 3-year itch. Every 3 years I have to do something new. So after 3 years or so of practicing, I got my specialty. I did a residency in orthopedics and manual therapy. And that's when I was like, wow, if I could just focus on one person to really do hands-on stuff, then I could, okay, try something, great, try something else. Oh, that would be amazing, and I wonder if they really could get better. So about 4 years ago, 3 to 4 years ago, I had a student that was, you know, that's part of learning. Before you graduate, you have to go work. Actually, you pay tuition to go work and see patients. But then I said, okay, you're about to graduate, you need to do your own thing, go see 2 patients an hour, and I'm going to spend time with 1. It was amazing, because people were getting better quicker. Instead of seeing someone for 12 to 15 sessions, I started seeing people for 5 and 8 sessions. So I'm like, wow, this is kind of neat. That practice got, you know, changed, owners changed, not a pretty situation. And then I decided, I was like, wow, I could make a difference. And so I had a couple of friends who had their own private practices and stayed out of network. And I was like, oh, what is that about? Like, yeah, it's the best. You can see one person focus on one thing. And I was like, wow, this is great. So, 2.5 years ago, I was like, wow, the practice changed ownership and I have some time off. So I'm gonna go, and on the day that I have off, I'm going to start my own practice, but I'm going to go see patients in their houses, so it doesn't have anything to do with the same services that they offer in this practice. Sure enough, people were responding well, and it's one of those like, wow, is it really going to work too? Yeah, this really does work. Long story short, what do you mean you have your own physical therapy practice? Yeah, I told you in a meeting, and the 3 of us, so, well, that's it, you're fired. Which was the best thing that happened to me, because in April, 2 Aprils ago, I was like, okay, this has to work because I have 2 kids to feed in my house and my student loans to pay. So it has to work. And I was like, but how can it not work? And so all my attention went to starting my practice and really focusing on what is the #1 goal for Fluid Physio. I want to be the best manual therapy place and get the people better, faster, when I couldn't do that before. So in the past, I would see, my patient population was kind of like, okay, some people were okay, they got better, our bodies get better, they heal, so okay, it's okay. Then I had a good number of people like, yes, awesome job, John is great, see you later. And then I actually have a good number of people who's like, no, PT doesn't work for me. That's not it. It's like, well, no, it's not working because I can't pay attention to you, or I don't even know what you just did because I wasn't looking. So when I started seeing patients in my practice, now it's something like this. Yay, things are changing. Now, stenosis, the white hair, I can't change those. Here's something to dye your hair, but that's it. But some of those things can't change, so it's learning how to manage our changing bodies. Learning how to sit better, how to rake better, or how to do some of those things better. And then there's a good number that it's like, yeah, we tried, but it wasn't for me. So then that's when, okay, so maybe you do something else, or send you to one of my preferred physicians that can get you in that same week. Or you know what, I want you to go see your physician to get some blood work because this doesn't really sound like something musculoskeletal related. Not a good conversation to have, but it's something that needs to happen because before, these people just went to see me and it's like, okay, you got the heat feels great. You come with the heat, oh, this is great, right? But it doesn't last. So that's kind of what I see in Fluid Physio and why I've been pretty successful in growing and now as big as we are because I really love what we're doing here. So it's exciting because as a physical therapist, I get to really do what I was taught to do and the skills that I spend so much time and money to do, and then actually see the results. And my results are, some of them are up there, and you guys can see some of those, our results over there. But enough about me. Time to stand up a little bit. So I'm going to have everybody stand up. We're going to go through a little bit of movement. And for you guys that told me a little bit about it, your stories, I'm going to ask you to pay attention to how things feel when I ask you to do a few different things. So, better? Okay, so the first one is, make sure you have a little bit of space. You're just going to try to bend forward. So when you bend forward, what happens? Does that make your pain worse? Do you feel relief? Do you get symptoms down your leg? Good, you guys can come back up. So, now you're going to put your hands behind your back and see what happens when you bend backwards. Does that make your pain worse? Better? Do you feel it go down one of your legs? Do you bend your knees because your hip flexors are tight and you can't really do it without your knees bending? I don't know.
I should feel better.
Okay, I'm going to ask you in just a second, so keep that in mind. So, good. How about to either side? To one side, try to slide your hand down the seam of your pants without bending forward or backwards. What does that do? Better, worse, relief? Good, now we moved a little bit. Now you guys can sit down. And then Angela, you were saying that actually felt better bending backwards.
Yeah, I mean, even with any type of stretch, I'm finding that it does help, but it's only temporary.
Yeah, but backward bending felt better. Yeah. Did it feel better where you still felt something or no?
I felt the stretch.
Okay,
That's it.
so
I'm
just
feeling the
stretch.
stretch. But
And it feels good.
pain,
It's
yeah.
like, oh yeah, that feels good. Okay. How about Mary? Any of that change your symptoms?
Mm-hmm.
They all kind of bugged it?
Forward wasn't too bad. The side stuff, going to the left side, which is the bad side, was really bad. And the right just,
Meh.
meh.
All right. The forward was okay.
Forward wasn't bad.
And backwards was meh.
If I feel it in the insertion
Okay.
area,
Okay.
insertion point.
Oh, that's nice. Okay. Okay. Meh. Left was the worst. All right, Fred, what was it for you?
When I did the back thing.
Uh-huh. So when you went backwards, you're
Yeah.
like,
The others were okay.
Okay. All right, Vivian,
When I went back, I felt it a little in
in the leg. Okay.
And
So
a little
backwards.
on my right side there.
Mm-hmm. Okay, how about when you went forward?
Nothing.
Nothing forward, just sort of that. Okay, and then Daphne. Daphne.
I'm just stiff, so
Yeah, so
anywhere was
everything was
stiff.
sort of like,
But having done it, now I have pain behind me sitting there.
okay. Okay. So interesting in that even though you mentioned the nodules being in your buttock, you did some activities. Although forward can put some stretch to it, but
Yeah, but these are two different things.
yeah.
I have the pain in the butt and the nodules.
All right, and then Fergus.
It's stiff all the way.
All of them, did anyone make it better or worse?
Maybe the back was, felt probably a little worse.
Okay. Okay. Very good.
Yeah,
All right,
yeah.
great. So going back to our paper, the first step, okay, the first step is finding out that if the numbness or tingling or pain or whatever your pain is, if that is reproducible, so if I can cause your pain by making you move a certain way or doing something to you, then if so, it's likely reducible, because then I know how to take it away. So if you have pain with any one of those activities, so for example, sitting is usually forward bends. If you have pain with sitting and I can make you bend forward, then I know how to take it away. If you have pain backwards, it's kind of like standing and walking. So that's how you can correlate some of what you feel in your activities with some of the exams that I do, or that we do in here. So the goal of this workshop is going to be to help you determine if you fit any one of these categories. So Daphne, for you is a little bit different, but it doesn't mean that just because there's one thing going on, there could be a little bit of many different things happening. And so perhaps if you address one of those things, maybe that'll change the other things. So the single biggest mistake, can anybody guess what the biggest mistake that you can make is?
Just ignore it.
Ding!
Ignore.
Ignoring it. Yes, ignoring it, because it's just like, oh, well, it's okay, it's not that bad, or, oh, I'm busy, my kids are busy, and I've got stuff going on, but, then it gets a little worse, and then it's like, so you ignore it. You're making some excuses, or you're just like, oh, no, nothing's happening, I'm just going to sit like this because I can't sit normally anymore. The second thing that you need to do, that happens, is, well, maybe you don't ignore it, but maybe you alter it. And what is altering it? That could be, I'm going to take, Advil is my best friend. Or I'm just going to make sure that everywhere I go, I have a place to sit. Because I know that I can't walk very far, so I'm just going to make sure that there's a chair. Or I'm just going to walk with the cart, because I can't do that. Or maybe I'm just going to stand the whole time and eat my meal standing, and I have a stand-up desk. Great. So there's no more pain. Or maybe you go get an injection. Maybe you go get meat tenderized, right? Maybe, so it's how to, or maybe you go get this fancy laser that I'll tell you guys about. So it's things to altering it. But ultimately, you need to handle it. And so how do you actually handle it is finding out the actual cause of what is going on. And so to handle it, you come and see a physical therapist, whether it's us, whether it's someone else. Some people have already seen many or chiropractors, so it's actually finding out what the root cause is. And oftentimes, when I was in the traditional setting, it was kind of like, well, I don't have time to find out because I have a 40-minute evaluation and I just need to make sure I can give you something to do at home. So handling it. So what is it that we do? Manual physical therapy, or how we do different in fluid physio to handle it. So we focus on being best manual therapy place. So what I wanted to do is kind of show you a little bit about how we handle some of that. So the reason why I asked is because now I can see, depending on what's going on, sitting, sleep, everything, but I wouldn't want to mess with Mary because you had surgery recently. Let's see, stiff leg. All right, Vivian, would you mind volunteering? Okay. So remember, I'm recording it, so if you're okay with that. So Vivian, so you were saying that it's kind of this groin pain, right hip, it hurts when you lift the leg. Sometimes now that it goes down to the knee, the right mostly, but also the left, and back bending was bad, right? I was like, ooh, okay. Can you come forward, please? So the first thing that we have a time to do is now we just watch. So I'm just, can I have you face that way, please? So we're just gonna watch Mary, and so one of the things that you come in here, it's like looking at, okay, I'm being here, so I'm just watching. There's different landmarks that I look at, and any other hip, knee, surgery, major issues?
I had a shot in my knee years ago.
Okay.
Years ago too. You get old. You go old.
We use our bodies, right? And we just need to learn how to deal with our changing body. It's not bad, it's not, it's just experience. All right, so I have little landmarks, and my landmarks, I go by the little bones right here, because they're supposed to be even. We're not symmetrical in the sense that if you look in a mirror, the right side of our face is just different than the left. So I don't look for perfect, perfect alignment. Similar, but not perfect. Can you take a little step to your right, please? Thank you. So I'm just looking at my little landmarks. Are you okay? Is one of these sensitive here?
A little bit.
More here?
Yeah.
Okay. So, can you do a 180 and face that way? So, and again, not everything, it doesn't mean that you can only have one thing going on. So if I put my hands on her little landmarks, I'm gonna find my little spots. Sorry.
That's all right.
That hurt me.
Can you see the difference?
Yes.
Yes.
How one's a little higher than the other? This is a little higher, not much. Vivian, can you bend forward, please? And come back up. Okay. Can you bend backwards, please? Good. And that's
I
where you
feel that.
felt it more?
Yeah.
Here?
Yeah, right here.
Okay. Did it go down at all?
Yeah. Goes down the buttocks.
Okay. Good. Come back. Okay. All right, Vivian. So I'm gonna have you. Can you come on your back, please?
On my back.
Yes.
Face it there.
Nope. We're gonna go on the back.
Okay.
Here's a pillow.
You might need to have, you gotta get help to get it up.
Can you is it all right if I slip your shoes off?
Okay.
Go ahead, and can you lift your hips off the table? And down. Good. So I'm looking for that. Do I see the same thing when she's lying down? Okay, and it looks like, one leg is a little longer than the other. And it doesn't have to mean that one leg really is longer than the other, but sometimes when the pelvis is rotated, it will appear as though that's the case. I'm just gonna do a few leg movements.
This one's gonna hurt.
And tell me when to stop, because I can be nice.
Hurt.
That's pretty bad up there, huh?
Yeah.
Okay. Okay. So relax it as much as you can. And let me do it. She still helps. Is it painful? And if I put pressure here, does that make a difference? Can you roll to your left side, Vivian, please?
I can feel it when I'm rolling.
Yeah.
Okay.
Be okay here?
Yeah.
Can you bend your knees for me? There you go. And can you scoot towards me a little bit? Thank you. A little bit. I promise I will love
Okay, that's all right.
you. If I do this is a little
A little bit.
painful.
Yeah.
Okay.
And at night, if I lie on this side.
Yeah. Forget it.
Yeah.
So, I'm just gonna move the pelvis around a little bit. And this hand, that's yours.
Okay.
Here.
That I feel.
Already you feel it.
Yeah.
So I'm just mobilizing that pelvis a little bit. It's okay?
Yeah.
Speak up, because I don't feel anything. All right. Not here. That's okay?
That's okay.
Okay.
That I,
A little bit?
yeah.
Okay.
Right in the groin.
Alright. So, manual therapy to move the joints. Really, like, I can break a sweat doing some of these. Soft tissue mobility, this feels pretty tight, right? Come here.
Ugh.
The table's gonna go up.
Okay.
It's gonna be so exciting, wow!
All right.
Alright, let me have their leg. Is this kind of sensitive through here?
No.
Okay. But your knee bends all the way. Okay. Can you roll on your back one more time, please? Good. And I'm just gonna pull on this one a little bit, then this one for me. Good. Just gonna feel her hip mobility, hip joint, which is a little different than muscle length. You feel that in the back, up there, in the groin.
Groin. Right here.
About here. That's okay.
That's okay.
Joanna, which leg is shorter, the right? Which one feels
Yeah.
shorter? The right?
Yes. Mm-hmm.
Okay. Got it.
Feel that. Is that painful there?
Yeah.
A little painful in there?
Yeah.
Can you bend the knees? So, I don't have to go in and do all the joint stuff. I can do muscle energy techniques that I'm gonna try with you.
Okay.
So, push your legs right into my hands, and what we're gonna do,
Okay.
Vivian, yeah, I'm gonna go in 3 different spots,
Mhm.
and then we're gonna go in.
Okay.
So we're gonna hold a little bit each one. Ready? Push. And relax. So really, I'm trying to bring her legs out a little bit more. And push. Trying to get her own hip muscles to do the moving for me. And relax. And out a little bit more. Good. Push into my hands. And in. Push in. And relax. In. Push. And in. Push. Great. Can you lift your hips up a little bit for me? And come down. Good. Good. Keep that relaxed. Okay. You feel that in here.
Yeah, and in the back.
In the back. Okay. All right. So, I'm gonna bring the table down, and you're gonna take your time and sit up.
Roll over.
Yeah, you've learned how to get up, right?
Yes.
Okay.
Thank you.
I'm gonna stand up. Good. And you're gonna face that way.
Yeah.
What happens when you bend backwards? Oh, it's going a little bit further now. Still
Yeah.
feel it?
Better.
Good, we come back. Okay. So, a little bit different,
Or
right?
even.
A little bit, yes. Thank you.
Thank you.
So a little sample of what manual therapy is, right? Hands-on stuff, moving things around. But now you have to follow it with some exercises, which you can see me afterwards and I'll tell you what to do, because I just did all that. Well, your body has to keep it there. It's not just come in and do the mobilization, see you next week and keep coming, is I want you to learn how to handle it. Not the best business practice to have your clients see you less and less and not see you anymore, but that's the idea, is our bodies get better. So, quick water break. Moving along. Okay, now I can get rid of this. Very good. So, this is why you came, the top 3 causes of lower back pain and sciatica. So, the first one is going to be a herniated disc, right? So what is a herniated disc? We have the bones, the spine, here with the little spaces, right? Kind of a raw sample. And you have the discs in between. So this is as if I were standing sideways. This is the nose and the face are here. Okay, the disc is here. And then right along the center, here comes the spinal cord. And the nerves come out of these little foramens, or holes. And so what happens, with a herniated disc, anything that pinches that nerve, so when you bend forward, this comes down, some of that disc material pushes into the nerve, and you feel the pain down the leg when you bend forward. Right? So with a disc herniation, most commonly happens between the ages of 30 and 50. And it can go down one side or the other. And actually, recently, they've shown that a disc can actually heal. So about in 2016 in April, USA Today published an article from research showing that it was only a case study. Why only one? It's because they did the MRI after the person went through therapy and got better, and the MRI is expensive. And the MRI showed that there's actual healing that happened in the disc. So just because, 3 years ago they told you had a bulging disc, so a bulging disc is just a little push. A full herniation is where some of the disc inside can protrude and irritate the nerve. So you can have physical irritation of the nerve where there's extra stuff from the disc pushing into the nerve, or a chemical irritation to where all that waste product is also irritating the nerve. So, but these can heal. There are still many studies to be done, but it's not a doom sign. So usually people with herniated disc have more pain bending forward, but that is not the case. The next one, we have you, Fred, is stenosis or degenerative disc disease. And what that is gravity takes over, so the spaces get smaller, and as the nerves come out of those little spaces, well, guess what? When you bend backward, that little space gets smaller and impinges on the nerve. This is someone like you that, oh, I sit, it feels great. I use the cart, great, because I'm bending forward. So it's different things, and manual therapy can help with that. And then doing home exercises to maintain that open space for the nerve to come out. Usually it's with an older population, and it's with pain with the standing, walking, or those back bending. And there's that last one. It's SI joint, or a pelvic problem. So if we look at a raw picture of the pelvis, right? So the pelvis is right here, and here's the sacrum. And then if you have the vertebra, this person has major scoliosis. But out of these, which one do you think is the most important piece? Think about that. Pennsylvania, it's the Keystone State, right? So it's this two right here. So joint pain or pelvic pain, these are the people that have pain with sitting, have pain with standing, have pain with walking, have pain with everything possible. And so what happens, the SI joint or the sacroiliac joint is the joint between the pelvis and the sacrum. And it's a really weird, if you were to like open it up, it's a really weird sort of like this S-shaped thing where some places are convex, some places are concave, and there's really only about 3 to 4 millimeters of movement. Super, super smart movement. But our pelvis actually rotates and does a little tilt when we walk. And so the SI joint, you know, the nerves get impinged and you feel the pain down the leg. The SI joint can actually refer pain down the leg as well. Usually, SI joint pain, so we talked about this could happen to a teenager, this could happen to a 93-year-old, or 95, or it could be any age. Pain with all positions. Usually also as groin pain or hip pain, or there's sometimes people can have issues with incontinence or pain with sexual relations, or usually it wraps around, it's the leg, but it usually never crosses the knee joint, and it's more central than the sciatica or the nerve from the back, which goes more to the outside. And that is something that you can just do some manual therapy. Okay, make sure here's some exercises, right? And take care of it. And there you go. Oh wow, it's like I feel better and I move better. So that's an easy, they're easy to fix. They're easy to take care of. And that's when you could have something that it's more of a, you can have someone coming in with a diagnosis of, oh my gosh, it was, I don't want to give you that example, but something like, oh, my kidneys had an infection and I had back pain, but I also have pain with sitting, and so it could be totally medically unrelated, but you could have the same SI joint stuff where you take care of it, and oh wow, I can move better. So that's the third type, and actually the more common one that I see. You could have SI joint and lumbar stuff and some of the other discs going on. In physical therapy, however, we don't treat because you have a disc herniation or because you have stenosis. The way that we found research showed that we treat it according to how you present. So people that have and come in and say, I have these bulging disc and herniation, that doesn't mean that I'm going to give you a bunch of back bending exercises, because it doesn't happen that way. So in physical therapy, and evidence from 2004 and 2006 that did randomized trials, they showed that if you fit, we treat it according to categories. If it's a directional preference, if you have symptoms down the leg, or if you have symptoms with different types of things, then we know exactly how to treat it. So, back to my list, how do we treat it successfully? I found that manual therapy is a huge addition because you move things around, soft tissue joint, you can actually mobilize nerves. Then we teach people, so it's the hands-on to return the normal movement, because just because you had a disc herniation doesn't mean that you can never bend forward to pick up a tissue again. You might want to learn how to pick up a heavy box, right? But it doesn't mean that now our backs can't ever bend back forward, right? Then you have to do exercises to strengthen and stretch, to stabilize the pelvis. And so there could be a couple of different things happening, to where now you had that kind of turn. We want to find out what is making that pelvis turn. Okay, let's use your own leg muscles to bring things back to where they need to be. If this is so tight, why is your hip flexor so tight? But it actually wasn't. You have good hip flexor length. But you feel that pain in the groin. Your hip flexor actually wasn't tight. Yeah, you have the pain in that area, but that doesn't mean that is that your hip flexor, which is the muscle that brings it up. One of the reasons for you when you have pain here is when you bring your leg up, the pelvis is supposed to rotate backwards. And that side wasn't moving very well. So when I just moved it around, oh, I didn't have you do that. Okay, so so we talk about, here we offer the hands-on therapy, but the other thing that recently came available, and so that's where you could do a shot. You could do the Advils, things to help you get through so you could do more. So more recently, I purchased this laser. It's deep tissue laser, and it uses light therapy. So this is non-invasive, and the reason why I chose to make the significant investment was because what is my vision? My number one goal is to get people better faster. And so this actually has been around for about 20 years. And they found that it effectively treats pain associated with inflammation in many, many ways. So thinking of light, so it's light therapy. So in the way that sunlight helps plants grow through chlorophyll, and that's how they make more plant cells and get taller and longer if we take care of it, or not take care of it. This is the way that light therapy can help with tissue regeneration. So I have a little video that if you guys wanted to, I can show you where. Or the little booklets, there's a little link that you can go, and it's a pretty, actually it can be a little bit difficult animation that goes through that you can go check it out and how it really does it. But it's light therapy to help tissue regeneration and truly help you get better faster. Not just for pain relief, but also for tissue regeneration. So it's endorsed by our National PT Association, the World Health Organization, and really, up until recently, it was only if you're in the NFL or Major League Baseball or big hospitals that were treating big people, that's where you could get it, but that's sort of why I decided to bring it on to more people where it could be available. And so I have it differently and set up where, I work with other chiropractors that they don't have it, and they send me their patients, we'll do the deep laser treatment. If their patient's getting better, great. But I form partnerships with especially chiropractors because we really truly specialize in movement. Because if you don't address how you move every day, how you sit like this, and bring up some of these points, then your body's gonna go back to its old habits. Most of the your dominant side. We write, we talk, everything's right-handed. You carry your kids on this side because you can do things with this arm. So you develop ways in how you move, and some muscles get shorter and some muscles get weaker, but one side gets really strong. So that's where we need to deal with the cause of some of those problems. So anyway, so I brought the deep laser, so it gets set up, but it's really light, and there's a roller, so it really looks red, but it's really not. It doesn't feels a little warm, and you get to wear cool sunglasses. But this is neat because not only can it treat pain related to inflammation because of musculoskeletal things, but people with something like, I had a patient with some endometriosis and certain things that I don't treat as a physical therapist, but that pain was being relieved by it because it addresses inflammation. So anyways, we did the Stampo. So there's been a lot of people that, oh wow, I've done the physical therapy in traditional setting and it hasn't worked, or because we talked about the hands-on, but then really looking at, I have the time to then ask you, oh my gosh, is it that you're going through a lot of stress and everything keeps tensing up? There's a really, research has shown that emotional, mental stress can affect and produce physical lower back pain. So, okay, so maybe you don't know how to breathe through your diaphragm and everything gets really tight because you do with all the crazy stuff and your kid's misbehaving or whatever it is. Okay, let's learn how to breathe through your diaphragm, take some deep breaths. Here's a really cool meditation app that we can work on. Maybe you have no idea how to engage your deep stabilizing muscles because nobody had the time to, okay, can you sit, can you do this? I had someone come in who had pain for 8 years, and she said, oh my gosh, I've done therapy so many times and it kind of helps and I do the exercises, but nobody taught me how to breathe and how to engage those muscles. Why? That's to me, it's like, how do you not? Oh, that's right. So there's awesome therapists out there that just don't have the time. And so that's one of the reasons why I chose to be out of network is because by being out of network with insurances, it's like, okay, we are taking care of what your goal is. What do you want? I want to play with my kids my grandchildren on the floor. Great. I want to do an Ironman and my calf hurts and I can't. Okay. It depends on your goal. Because for insurances, if you can stand up, walk around, go to work, and come back, that's functional. And so they don't care that you really can't go and play paddleboard if that's what you want. And so we take that out of the equation. But if you have out-of-network benefits, we can help you figure out how that can be covered and you can get reimbursed. The other part is, regardless, it's like, okay, yay, fluid physio, I'll help you. But at the same time, it's like, okay, other physical therapists, to find a good physical therapist, you can find out if you call them up and you say, do you do manipulations? It's like, oh, well, it doesn't mean that you need it, but if they say, yes, we do manipulations, that means that, yes, they have the manual therapy skills, they have the skill set available to be able to do the hands-on stuff to get you better faster. So that's really what you want to find out. If you live in Pennsylvania and you ask, oh, does your physical therapist do manipulations? You can't say that because it's illegal to say manipulation. You have to say grade 5 mobilization, which is the same exact thing, but chiropractors own that term. So it's a grade 5 thrust mobilization. But it really is the high velocity, low amplitude movement. So, stories and that's it. Was it worth your money?
Yes.
You guys get what you pay for? So really, the goal that I wanted you to have is, do you see how you could maybe fit into some of this? Now there are definitely diagnoses that are a little bit odd, but if it's something that we can reproduce, it's something that we can make a difference. So, are you guys ready to take action and do something about it? Right? So really, reasons could be, oh, I don't have time. Okay, or oh, well, maybe they're out of network, or oh, you know, it's just not bad enough for now. But I really, you know, if you guys came here, whether it was for yourselves or for someone else, like just take action, because a little thing that, oh, it's okay. I have people coming and saying, oh, well, I really have been having back pain for a really long time, and it just never got in the way. And a common one is moms, because they have something and their body goes through tons of changes and baby comes out and they don't have time. France is a big advocate for as soon as, I believe is, do you know how many, 6 weeks later, 6 weeks after that women have babies, they have to go to physical therapy because it's learning how to engage and use your body now that it's different. And so life gets in the way, and so I urge you guys to take action, and so either here or someone else, somewhere else. If anybody, you know, I had someone that was like, yes, I'm gonna take action. Some people have already taken action and brought someone else along, and we have other people that is like, oh, that sounds awesome, I've tried everything else, I wanna do something else, sign up. And so some people have signed up for the evaluation right away, and so if that is something that you're looking to do, our evaluations there are an hour and a half. We only work with one person at a time. And then follow-ups are usually an hour or 30 minutes, depending on what you need. So if it's time that you're not, oh, you know, I'm too busy for work, I start seeing patients at 6:30 in the morning, 2 days a week. Or we're here until about 8 o'clock, a couple of days a week. So time is issue. Financial is another one, because we're out of network and we choose to stay out of network so we can actually help people, but we've worked people out so where if that's an issue coming in, then we plan around it. Maybe you do an hour at the beginning so we get you a good program, we do some hands-on. Okay, come back and we work through it. And well, it's not bad enough. I've had people that just come and do an evaluation to see like, well, it's just not bad enough. Okay, maybe it's flexibility that you need. Maybe here you go, we'll do an examination to, okay, what could you work on? Do one session, come back in 3 weeks and figure out if you've improved so that you don't get to be to the point that it hurts all the time and I can't bend and I can't walk. So that's pretty much it. So if anybody